Welcome to today's webinar. County Health Rankings and Roadmaps is a program of the University of Wisconsin Population Health Institute. This webinar is brought to you thanks to the contributions of colleagues and partners in Wisconsin and across the nation, with support from the Robert Wood Johnson Foundation. It is produced in collaboration with Healthy Places by Design, an organization that advances community-led action and proven strategies to ensure health and well-being for all. The University of Wisconsin-Madison occupies ancestral Ho-Chunk land, a place their nation has called Dejo since time immemorial. UW-Madison respects the inherent sovereignty of the Ho-Chunk Nation, along with the 11 other First Nations of Wisconsin. This webinar will be recorded. All speakers' views are their own. Guest bios and slides from today's webinar are available on our resource page. We will share a link to the resource page when the webinar begins. Stay up to date on all things CHR&R. Find us on Facebook, Twitter, and LinkedIn. And if you haven't already, sign up for our newsletter by scanning this QR code with your phone's camera. It's the best way to find out about upcoming webinars, our podcast, and our latest tools and resources. Your facilitators today include our host, Erica Burrows-Girardi, with support from CHR&R Communication Specialist, Colleen Wick, and the Collaborative Learning Director from Healthy Places by Design, Joanne Lee. We invite you to continue the conversation immediately after the webinar in our discussion group. Joanne Lee will be our lead facilitator. And watch for a chat from Colleen for details on how to join the group after the webinar.
Welcome to Segregation, a Threat to Equity. My name is Erica Burrows-Girardi, and this webinar is the first in a two-part series entitled Healing Segregation for Health Equity. I'm really excited for this series. In it, we're going to examine the historical drivers of segregation and the domino effects that lead to health inequities. We will also discuss how you can undo segregation and build opportunities for everyone to be healthy. CHR&R's webinars reflect the values that we hold as part of the University of Wisconsin Population Health Institute. Values of collaboration, integrity, excellence, innovation, inclusion, and courage. These are values that we aim to model throughout our webinars, and we hope that you will too. With that, I'd like to introduce you to the team that will aid in your learning experience. Let's start with Joanne Lee with Healthy Places by Design. Hi, Joanne.
Hi, Erica, and hello to our audience out there. So grateful that you're joining us for this wonderful webinar today. Just want to let you know there are two ways you can engage with us during today's webinar. If you have a question for our wonderful guest presenters, please use the Q&A box. I'll be monitoring the Q&A box, and we are going to answer as many questions as we can when we get to the Q&A section later during today's webinar. You can also engage with other participants in the group chat, but that is for a different purpose, and I'm going to hand it over to Colleen Wick to tell you how you can engage in the chat.
Thanks, Joanne. Hi, everyone. My name is Colleen, and I will meet you in the chat. Please use the chat to share knowledge or respond to questions we may ask you. And also, please join us in making the chat space welcoming by adhering to these guidelines. Share successes, lessons learned, relevant resources, and links. Please engage in respectful dialogue. Our chat conversations tend to be very engaging, as you could maybe see already. So if they are too distracting, simply close the chat window. Please know that the views expressed by speakers and participants are their own, and they do not represent CHR&R or Healthy Places by Design. Now I will pass it on to our technologist, Erin.
Thanks, Colleen. Hi, everyone. I'm happy to be here today, as always. If you have any trouble hearing or seeing the video, or not the video, seeing the slides, please send a message in the Q&A box, and I will see what I can do to help you out. It's going to be a great webinar. Now I'll turn it over to our host, Erica.
Thanks, Erin, and thanks to the entire production team. You guys always work so hard to make our webinars special, so thank you so much. What comes to mind when you hear the word segregation? For many of us, it may be images like this one of courageous little Ruby Bridges. She was the first to desegregate her elementary school in New Orleans in 1960. Segregation is the policy of keeping one group of people apart from another and treating them differently, especially because of race, sex, or religion. And we may be asking, well, didn't segregation end in 1954 with the Supreme Court's decision on Brown versus Board of Education? At least that's what many of us learned in high school. Well, maybe you don't even think that segregation is an issue today. We don't know. But I will tell you this, the reality is nearly 70 years after this historic ruling, 30% of American students attend racially segregated schools. Now, this despite the fact that America is increasing in diversity. So there's no doubt segregation still exists, and it comes in many forms. Racial and ethnic segregation, economic segregation, and residential segregation are examples of how we see segregation in our society today. And it impacts all Americans. The consequences of segregation go well beyond education, as we're going to learn in this series. There's a domino effect that limits opportunities for all of our health and well being as a result of segregation. So, during the Healing Segregation for Health Equity series, we will hear from experts who will help us answer questions around segregation. How does it show up? Why it happens? And what are the consequences? Dr. Tiffany Manuel, the president and CEO of the Case Made, is joining us today, and as is CHRNR's Dr. Christine Muganda. Then in part two of this series, we'll be joined by best-selling author Richard Rothstein, who wrote The Color of Law, A Forgotten History of How Our Government Segregated America. Rothstein also co-authored the recently released Just Action, How to Challenge Segregation Enacted Under the Color of Law. So you can actually register for that webinar now. Colleen might be chatting it out now, but if not, you'll have an opportunity to register for that webinar so you can join us for part two of the series. So today, here are the three areas that we're going to cover. We're going to talk about the historical and present day context around segregation, the relationship between segregation and equity, and segregation's link to civic participation. And with that, I want to join you, and I want to ask you to join me rather, in welcoming a familiar face to our webinars, my colleague, Dr. Christine Muganda. Hi, Christine.
Hi, everyone. Grateful to be here with you. Thanks for sharing time.
Yes, and thank you, Christine. We're going to circle back to you in just a second, but right now, I also want to ask you all to join me in welcoming Dr. Tiffany Manuel, or Dr. T, as I'm told she likes to be called. Dr. T is the president and CEO of The Case Made. Dr. T, how are you today?
I'm feeling so excited. And I see we got a couple people in the chat from Detroit, Michigan. I'm also from Detroit, so looking forward to
Oh,
the
good.
conversation with y'all today.
Well, Dr. T, I could not be more excited that you are with us today. And so we will be circling back to you momentarily as well. Now, we have a discussion group right after the webinar. Some of you may have heard about it in the beginning of the webinar, but this is our space to unpack what you're going to hear today. So I'm going to ask that you make time to join us if you can. During the video intro, you heard about how these discussion groups are facilitated by Joanne. They're always very engaging. They give you the opportunity to learn from others and share what you're doing in your community. So Colleen's going to chat out information about how you can join a discussion group at the end of the webinar. I'm excited to say that Dr. T is actually going to join us. She told me, she's like, I'm looking forward to the discussion group more than I am the webinar. So I think we're going to have a great time in that discussion group. Please plan to join us if you can. And with that, let's welcome back Christine. Now, in a few minutes, we are going to hear from Dr. T about what brought us to where we are in terms of our society with segregation. But first, I asked Christine to give us some context around what we're calling this domino effect around segregation. So, Christine, is there a way to measure these effects?
Thanks, Erica. When it comes to measuring segregation, I think it's important for us to remember that segregation is multidimensional and that it's hardwired into many of our societal structures. So when we talk about these different measures of segregation in just a moment and the measures of the effects of segregation, I think of each one of them as capturing just one summation or just one pathway, just one of the wires on society's big switchboard. And attempts to measure segregation and its effects are not too new. So in 1967, President Lyndon Johnson established the National Advisory Commission on Violence and Civil Disorders, and that commission was commonly known as the Kerner Commission. And the purpose of that commission was to identify the causes of recent social unrest that had led to 43 lives lost in Detroit and 26 lives lost in Newark, and then additional deaths in 23 other cities across the nation.
Yeah, and Christine, I will add that the basic conclusion of that commission's report pointed to discrimination and segregation as a threat to our shared future if our nation did not press toward a resolution. And the report clearly states that to pursue our present course will involve the continuing polarization of American community and ultimately the destruction of basic democratic values. The alternative is not blind repression or capitulation to lawlessness. It is a realization of common opportunities of all within a single society. And this was written in 1968. It sounds like it's a precursor to equity, right? So, I mean, this is reason why measuring opportunities for all and moving toward equity is exactly what our shared work aims to accomplish. And we've been doing this for so long.
Yes, and I really appreciate that backdrop to the measures that we're about to share. So let's take a look at the county health rankings measures of segregation, and we'll start with a couple measures of racial segregation. So the first set of measures that I will point to are demographic measures. And within these set of measures, you can see the percentage of the county that identifies according to different racial groupings. So as Hispanic, as American Indian or Alaska Native, Asian, Black, Native Hawaiian or Pacific Islander, or white. And demographic measures can be used to signal regional segregation if we happen to observe a lack of racial diversity within a county. And then, of course, we can look for racial segregation within a county as well. And our measure of residential segregation is intended to do just that. It's an index of dissimilarity where the possible values can range from 0 to 100. And the higher values indicate greater residential segregation between Black and white county residents. So let's dig into this one a little bit deeper.
Okay.
The data here come from the American Community Survey. It's a nationwide census product, and it's designed to provide communities with a fresh look at how they're doing, how they're changing every year. And again, our measure is an index of dissimilarity. So that means that it's measuring the evenness with which Black residents and white residents are distributed across the census tracts that make up that county. And the residential segregation index is ranging from 0, and that represents complete integration, to 100, and that represents complete segregation. In the 2023 rankings, the national value for residential segregation was 63. So this is telling us that the majority of US counties are experiencing residential segregation between Black and white residents. The current state demonstrates for us that the intentional residential segregation of races in the US is something that has been very hard to undo. Even despite the Fair Housing Act, which happened back in 1968, segregation continues to be perpetuated today through a structured and interacting set of forces that include things like individual actions and institutional practices and governmental policies. And it's important to name that segregation is not benign. Research has shown that the differences in neighborhood characteristics, in access to opportunities and resources are pretty dramatic between racial groups. Next, let's take a look at the county health rankings measure of school segregation. And because where you live determines your school district, there are pretty close links between residential segregation and school segregation. So this means that children are often isolated from opportunity in a variety of different ways during a time in their development when neighborhood and school resources critically impact their well-being and their development, and as well as what opportunities are going to be available to them over the course of their life moving forward. And also for children who are segregated into affluent schools with peers who might share their same race, it's important for us to consider the effects of segregation there as well during, again, a really formative period of development. So segregation limits social interactions, and it can reinforce implicit racial assumptions and even attitudes of inferiority or superiority. And this is all because our brains are just wired to make sense of what we're observing and what we're interacting with our environment. And physical separation just fosters this really powerful and kind of lasting perception of who belongs in a space and who deserves access to different resources in different places. So Dr. Martin Luther King Jr. put it this way: segregation leads to, quote, the false sense of superiority of the segregators and the false sense of inferiority of the segregated. So again, segregation is something that really harms all of us, and it actively works against our national values of justice and unity and equality. So returning to the county health rankings measure of school segregation, we use a segregation index that's called the TEALS index to measure within county segregation in schools. So this index is ranging from 0 to 1, and the lower values represent racial compositions in schools within a county that approximate the race and ethnicity distributions in the student populations that live within that county. Higher values then represent higher segregation within schools. And racial segregation is not the only form of segregation that we can measure. Economic segregation is another form of segregating social groups. And because of the historical and current forms of racism in our country, racial and economic segregation are intertwined. So here we also see the perpetuation of segregation. These measures reflect separation from opportunity and also the likelihood of generational cycles of economic insecurity. So we'll start with the county health rankings measure of children in poverty. And this is the percentage of people who are under age 18 and live in a household where the income is below the federal poverty level. This measure can be disaggregated by race groups, and you can use that to see the intersectionality of race and poverty in your county. Next, let's take a look at the measure of the gender pay gap. And this is expressed as cents on the dollar, or women's average earnings in cents compared to every dollar of men's average earning. I would also like to highlight our measure of income inequality. The County Health Rankings measure of income inequality is a ratio, and it compares the household income of the highest 20% of household earners to the household income of the lowest 20%. And if we have a higher inequality ratio, this indicates a greater division between the high and the low ends of the household income spectrum. So the size of this gap can serve as a signal for us that some families could be struggling in this place to afford basic needs or to access social spaces in counties where the market value is going to be influenced by the spending of those high income households. And like the residential segregation data, these data used for the income inequality measure also come from the American Community Survey. Next, let's take a look at the measure of severe housing cost burden. And this is the percentage of households in a county that spend 50% or more of their household income on their housing. And so we know when housing costs start to outpace local incomes, households struggle to find safe and stable shelter, but then they're also facing these difficult trade-offs in meeting their other basic needs. So you can imagine when the majority of your paycheck goes toward your rent or your mortgage, it makes it really hard to afford things like doctor's visits, healthy foods, utility bills, or even reliable transportation to work or to school. And then the final measure of economic segregation that I'll highlight today is school funding adequacy. And let's take a look at that's a little closer at this measure too. The County Health Rankings measure of school funding adequacy is the average gap in dollars between actual spending per pupil and the estimated amount of spending required to support achievement of average test scores.
And I want to reiterate that that measure tells the funding required for just average achievement when we all want our students to do better than average, right?
Right. Yeah. Erica,
Yeah,
thanks for highlighting that. So,
yeah,
again, these data are only communicating the funding gap toward an average outcome. And certainly, average could be very different from a child's full potential.
yeah.
So when we see counties that are experiencing underfunded schools, we know that this can impact the effectiveness of the education, which can lead to lasting effects on a child's ability to access employment opportunities and social supports as an adult. And children segregated from opportunity through segregation from quality education can experience lasting effects through their life. And this is a pretty vivid example of the ways that racial and economic segregation can be perpetuated over generations and can negatively impact the overall health of the entire community. And there are even more ways that our society segregates social groups from opportunity and from health. Larger societal structures can lead to and can perpetuate segregation. And one example of this is the way that access to clinical care in the US is tied to employment through employer supplied health insurance. So those who are uninsured are likely to have a more difficult time accessing quality healthcare for prevention and for treatment. And I'll just highlight two county health rankings measures in wrap up here that speak to this example. The county health rankings measure of uninsured is the percentage of the county population under 65 without health insurance. And then the county health rankings measure of unemployment is the percentage of the county population ages 16 and older, unemployed, but seeking work. And again, because employer sponsored health insurance is the most common source of health insurance
Mhm.
coverage, in addition to limiting access for opportunities to maintaining a healthy life and accessing opportunities for health, unemployment can also limit access to healthcare in this
Yeah,
way. So in wrap up, what do we do?
yeah.
Returning to the Kerner Commission report, this report declared that only a commitment to national action, compassionate, massive, and sustained, with racial integration and equal distribution of resources as the primary goals, is going to resolve our shared crisis of segregation. And that this change will require the nation to commit resources and will require the people to embrace new attitudes and understanding and will. So here we are 55 years
Yeah.
later after this report. And I feel that these recommendations still hold a lot of promise for us. And our collective society has a lot to be gained by putting them into practice.
Yeah.
So we continue to hold this responsibility to make our vision of health equity a reality. And we're working toward this reality where everyone has a fair, a just chance to lead the healthiest life possible for them, with communities having high quality schools, good paying jobs, there's access to quality health care. And this is regardless of where we live, who we are, or the circumstances we were born into. So working toward this reality where it's a place where differences in race and culture, perspectives are celebrated as fundamental to our health and our well-being. And this is our vision of health equity.
Oh, Christine, that's just so beautiful. Thank you so much. And if you have not checked out your county snapshot, you need to do that today. Get a copy of these slides that Colleen has already chatted out and look through those measures and see where there might be opportunities to dismantle segregation based on the data that we know is happening, based on what we're seeing happening in your county. Look at your data measures because Moving forward requires a long term process that involves you, a long term process of liberation, dismantling systems of oppression, repairing wrongs, and healing from trauma. So we continually learn from our history, folks, even as we write a new story. This one, a story that is grounded in justice. So we need you on board with us in that. So thank you so much, Christine. Hang around for questions. But right now, I'm going to re-invite Dr. T back to the mic. And Dr. T, you know, um, Christine laid a foundation for us with telling us how we can actually search for this data and stuff and see what it looks like in our community. But now I really want to get down to the nitty gritty. Like, how do we get here? Why this is happening? And what, of course, what do we do? But you have such an interesting name from your organization. It's also the name of your book, The Case Made. Tell us about that first, and then we're going to dig in.
Absolutely. So thanks. First of all, thanks for inviting me to your session today. This is such an important topic that I'm glad that you all have devoted some significant resources, not just to educating folks, but to getting people excited about what we can do. And Christine, that was a great place to leave off. I'm happy to pick up what you just put down, which is about the just future that we all want. I think the whole reason that probably most of you are on this call today is because you want to do something about what you see in the world as being unjust, right? Some of that because of racial, economic, and social segregation. And if you want to do something about it, the question is, what do you do? And I would say the reason my organization exists in part because, myself as a data wonk, I, went to graduate school, got a PhD because I thought the data itself was going to solve for this. I thought that once we had data that would show by the benefits of investing in people and communities, that it would be irrefutable. You would just go to policymakers and you say, look at this amazing data about what the needs are, what can happen when we invest in the power and capacity of people. And they would say, oh my God, we've been so silly, right? We haven't been investing in the power and capacity of people and communities. And we should be doing that because we all benefit, right? And they would make these grand gestures. And then, all of the challenges of having our unjust systems would be done. Well, since the time when I certainly finished graduate school and, started to make a living for myself and probably many of you on this call, we have exploded in terms of the level of data that is now available to us.
Yeah.
Right. And so we have all this great data, right? County health rankings, all this great, amazing data. And the conversation, I would say, my own personal assessment is that it's actually the conversation around some of these social issues has actually regressed, right? Not progressed. And so the question that lots of folks are asking is, how do we take this data, which is now so important, which is now, like we can now, if you think about the data that we have on an aspect, in addition to the county health rankings data, folks are using amazing data sources to tell about the nature of what's happening in places in real time, which is amazing. In some of this work, and struggling to figure out how to tell a bigger story that inspires folks to get involved. So the Case Made was really born out of saying, listen, folks, there is a way to build public and political will to do the things that we all want to happen. There's a framework for how you do it. There's a lot of good social science to tell you how you persuade people to lean forward when leaning forward is hard, especially on issues of equity, right? Which require folks to really dig in a way that they might not have done so in the past. And it takes some work to be able to do that. So the Case Made is about how you begin to do that, a framework for being able to do that. And I also say, I'm also serving just temporarily as the executive director of the Redress Movement, which Dr. Rothstein is as the founder of, that really looks at issues of racial segregation and how we take action. So looking forward to hearing a little bit more about that.
Well, folks, a link to the Case Made, Dr. T's book is included in the resource guide that you'll get tomorrow. So be sure to check out the book. We were talking earlier, Dr. T, about this myth that segregation ended, with Brown versus Board of Education, that Supreme Court's landmark decision. But we know that's simply not the case. What does segregation look like today? Christine talked a little bit about the numbers, but what does it look like? Where do we see the segregation happen? What sectors are we seeing this happening in?
Yeah, absolutely. So I would say, a reason I shared this with you, the sort of National Fair Housing Alliance, folks who are fighting, racial segregation in terms of housing, but the way that they want to talk about it is its effects on us, that it's not just something that happened long ago, one, but two, the impacts of that reverberate throughout every aspect of our lives. It makes it more difficult to get credit, right, because of where you live and access to where you live, and the history of what's happened economically and socially makes it hard to get transportation to jobs. It makes it hard to go to great schools. It makes it hard to build wealth. Extremely difficult to live in healthy environments where there's healthy food and opportunities for wealth and well-being. Access to healthcare gets challenging. And so there are two reasons why I think this is important. One is because I want folks to really think about the broader effects of racial segregation, not just the act of racially segregating people, but what happens right after that. But the other thing I think is this is really important if you want to get people to pay attention to this issue. Like, very few people wake up right on a Tuesday morning, except for most of you, and say, racial segregation, man, we got to solve this thing. We got to figure this out. They don't. But they do wake up in the morning and say, man, I just, we applied for that house and we didn't get it because they didn't accept, our rental history. Our kids aren't going to the schools of their choice, or schools that we think we can confidently say are educating them for the future careers they want. We don't have good, transportation to get to our jobs, or we don't live in healthy environments. They say those things. And when we think about it, it's all of those things, right, that come to the center of this, that really focus on the impacts of racial segregation as part of that source. So
we're all walking in the impact of it. We're all walking in the wake of it, I should be saying.
Absolutely.
What happens as a result. So I want to take us back, because segregation just didn't happen today. There are actually policies and practices that allowed segregation to remain rooted in the US. So now it's structural. It's kind of baked into our systems. Like, what policies and practices got us to where we are today?
Yeah. So first of all, I just want to say, absolutely, that's a great question. And I think it's important to talk about the historical sort of, significance of this. And what I want people to focus on, especially in the 60s, I think that was probably the last time when we had just a major push, like a major, huge leap forward, right? And thinking about issues of racial segregation. And I want people to think about the fact that that those changes, the civil rights movement, 64, 65, 68, didn't happen because people just had an epiphany and said, you know what, we just need to make sure that everybody in this country, right, this, should have a future. There was a lot of organizing involved in that. Folks had to organize to get us to move forward, right? And there was a lot of struggle and strife. I mean, listen, you're all right. I know for many of you that may not be in the not so distant past, but a lot of our young people don't even know that history, that it wasn't an epiphany of us deciding to do things differently. Right. There was a lot of organizing and even violence associated with being able to get here. And now that we got here, right, a lot of the sort of basic, right, things, segregation is passed are finished, like redlining, right? It's illegal to redline. But the challenge is, and I think you hinted at it, Erica, is so much of segregation now is baked into structures where you don't actually have to call out particular racial groups that you don't want to live in a particular community, or you don't have to say these folks don't get this policy or those folks don't get it. It's so baked in that it's really hard to untangle, which is why this conversation about equity is so important. So let me just give you an example. So credit scoring, right? If you're a renter and you want to get a house, right? Credit scoring, right? That's how you go to the bank. The first thing they do is they pull your credit score. Right. And you think, well, that's a pretty benign measure. It measures like your ability to pay, for the house that you have. What it doesn't say, number one, is that the majority of people of color in this country are renters, and your rental history doesn't count, right, toward what the bank considers to be your ability to pay for a home. So even if you're paying $1,000 a month for rent, or maybe $1,200 for rent, and your mortgage payment would be half of that, they can't accept, right, your rental history, right, as part of their calculations. Now, on the face of that seems like everybody, that would, applies to everybody. But the impact of that disproportionately affects people of color, because they're the folks who have long rental histories,
right,
and not have the benefit of home ownership. Fannie Mae came out 2 years ago and said, you know what? If we had been accepting rental history, there were millions of Americans who actually would have been able to buy a home, right? Because they have the rental history. That's the kind of stuff we're talking about that's super important. Equity is saying to Fannie Mae and other lenders, if you accept this kind of credit, right, or accept this history, look at how you invite people in, right, to home ownership in ways that improve, right, the opportunities for wealth building, right? That's an equity conversation. And that conversation improves not only just their economic circumstances, but their health and well-being, right?
That's
A
right.
whole lot of income they can use, right, to take care of their health, doctor's appointments, other kinds of things, which is why we're on the call today.
Yeah, I want to talk about um, some ways that we see the intersectionality of what happens. This is not just all about race. This is about other issues too. Segregation impacts so much. Tell us a little bit more.
Yeah, and so there's a number of other things that just, as you said, it just like perfectly, right? The intersectional aspects of that, when you look at, the inability for folks to use their disability income or income that they get from disability insurance, or issues around maternity leave or your national origin or gender also intersect to what I say creates a wreck on a wreck, right? You're already in a situation of disadvantage from a racial standpoint, and then you have these other issues that have nothing to do with the goodness and graciousness of who you are, but are holding you back from being able to access all the things we just talked about: access to credit, great places to live, great places to shop, great places to take your kids, right? Transportation, all the things that we know are vital for healthy living in our country today.
And then 3 years ago, this happened.
Yeah, and I think just in terms of, I think it's really important. I want us to acknowledge that when we see like health challenges come up, this wasn't, the COVID-19 was certainly a huge, health challenge, but there will likely be others. I mean, this is the first of what folks are saying, right? Just because the nature of where we are in our lives today, right? That we'll have many of these kinds of challenges. And when you already have, right, as I was saying, the challenges of homeownership, living in communities that are environmentally challenged in many ways, shape, or form, things like COVID-19 just put a wreck on a wreck. And
Right.
So you've got already some disadvantage relative to health and where folks can live. You've got other disadvantages just in terms of things like access to clean drinking water. If you live in Flint and you were given the information to wash your hands frequently during COVID-19, really? Was that, I mean, right? So
Exactly.
that conversation becomes very different when you're looking at that. And this is why some of the sociologists, I put that quote in there, said, some neighborhoods are likely to kill you, not because the folks are trying, but because the disadvantages accumulate in ways that are just really challenging for us.
Yeah. So we really need to talk about how we can learn more and how we can not repeat the past. How can
Absolutely.
these
So
folks
I
help
think
us?
absolutely. And I'm so excited that y'all are here. I think the benefit of the fact that y'all are here means you want to learn more. You want to figure out how we undo the craziness of what happened before. These are some great resources. Richard Rothstein is a great friend of mine. We've worked on the redress movement together, but there are also other folks who are talking about this, about the connection between health and where we live and well-being and the kind of structures that got created, and also talking now about the way that we back out of those systems and reimagine them for the future. So kudos for everybody who's here. Keep going. Don't stop here. Keep learning, keep understanding this context.
And I have to put in a plug for our podcast in solidarity, because on our latest series, we actually interviewed Daniel Dawes. So please make sure you check out our latest series on our podcast. Let's talk a little bit more about how we see segregation tied into racism and how it impacts our health.
Absolutely. So I just wanted to put this in here to just say that we're not just, casual observers. We're not folks who don't have agency. And so how we respond, how you and I respond, how we are able to call people into this conversation, and not just call them in, but get people excited about what's possible is super important. So I love that Christine sort of left off in her presentation talking about the world that is possible, right? There's something about the messaging that we use and the way that we call people into this conversation that is powerful if we will allow it to be. And the data that we use can be a support to that, right? If we're willing to learn how to message that thoughtfully.
And I'm so glad you said that. How do we pull people into the conversation? Because in the last part, of this time that I'm spending with you, I want to talk about that. We want to
Mhm,
talk about how do we build, because people ask us all the time, Dr. T, like,
mhm.
I want to do this in my community, but I don't know how to build public will. I don't know how to do this. I live in a community where people want to bury their heads in the sand. So let's have this conversation. How do we build the public will?
Absolutely, absolutely. So I wrote a paper in a book called What Works. I was talking about what works on a number of different levels to address issues of inclusive communities. And the piece was really about racial segregation specifically, and it was about how both the difficulty of calling people into this conversation thoughtfully, but also the sort of strategies for doing so productively. And I started the piece by talking about this issue of how to sit fish see water. If folks have ever heard this parable that there are two fish that are just swimming along and they happen to meet an older fish who's swimming the other way, who nods to them and says, "Morning, boys, how's the weather?" And the two young fish swim along for a bit and go, what the hell is water? And I think
Mm,
when you look at what's happening in terms of racial segregation and its impacts, folks don't even realize, right? They don't even see all the specific ways in which issues of racial segregation are impacting their lives and really impacting their outcomes, health and otherwise. So the
mhm.
point of the story really is that it's about the most obvious kind of realities around us, but making it really apparent to folks and not throwing it in people's faces, but to say, listen, there are a whole series of structures around us that are having deleterious outcomes for folks, that are making it harder for many folks to be the productive, healthy citizens to generate wealth and to have prosperity and to have health in this community. And it's up to us together, right, to pull people into a conversation that not only brings attention to that, but makes people again excited and inspired by what is possible.
Right.
So in
So
that
well
article,
said. Oh, go
yeah.
ahead. Okay.
So in that article, I talk about a number of different narratives, but I also in the book I talk about how our energy has to be different, and I hope people feel
Mm,
that even in terms of the way that I'm talking about these issues. A lot of that data is so depressing, and I just want to take a second. I mean, think about the way that most people are feeling right now about the future of our country, the future of their communities. Folks are so really just demoralized about what's
yeah.
happening, especially like almost nobody watches the news anymore because it's so depressing, right? So when people are feeling that way, the last thing that we want to do is to throw at them a lot of negative data about what's happening in the world. This many people are poor and this many people can't afford this. Right. It's like really, that really is a wreck on a wreck. So our work in terms of case making is to take that data, right? A lot of great, data that y'all are sharing, and build a story around it that is
Mm,
inspirational, right?
nice.
And it takes a while to do that. It takes a skill set to do that because you got this negative data about everything that's bad and happening, and you go, wait a minute, how do I create a story of inspiration around the fact that this many kids are poor in my
Yeah.
community, right? It's not an inspiration about the kids that are poor. It's an inspiration about what we are doing. Like in this community, we refuse to take racial segregation and racism into our future. And
Yeah.
that means we're doing X, Y, and Z to address this issue. And then you can bring in the data. But changing the energy in the room is our
Yeah.
responsibility. And it's tough, but it requires us as leaders to show up differently than we have in the past.
I love that shift because you're right. Like most of us are trained to do exactly what you said you started doing. Like, if I just show them all this data, then everything is going to change. So most of us are trained that way. So I'm so glad that you're talking about the way that we show up differently. And this is another way we show up differently. I want to talk about narratives for a second,
Mhm,
because these are these stories that we kind of learn throughout our life about how the world operates, how it revolves around us, how we
mhm,
should act, how we should do, how we should respond. And those thoughts are often implicit or hidden,
mhm,
but they drive
mhm.
our decisions. So, why is narrative transformation, like changing the way we think, changing that narrative that drives our decision making? Why is that so important in redressing segregation?
Yeah, absolutely. So when people talk about narrative, first of all, I just want to define it, right? So people are really clear about what it is. When people say narrative, what they're really talking about is a collection of common beliefs or stories that we tell ourselves over and over and over and over again, so much so that it begins to function like it's common wisdom, even though
Hmm.
there may not even be any facts to support it. It may just be the way that we've come to understand the world, right? So one of the public narratives, for example, and you see here on the screen, that affects how we talk about segregation is when you say the word segregation, and especially when we show Black and white photos like I showed in my presentation, and we've showed it here in this presentation, folks get the message that segregation is a historical artifact. Like, we've passed that, we're done with that. That was 1960s, and that was right. So part of the way that you and I, right, and I say help fish see water, is making that history current, like showing the way in which, when I started at the top with that circle, it's not just something that happened in the 1950s and 60s. Yes, we have laws on the books to get rid of some of the worst parts of our sort of racist history, but it's showing up in all of the indicators, right? Even though, right, we've changed the way we do many different things. So narrative is this collection of stories, and we've got to start telling ourselves and sharing different kinds of stories, not the sort of negative stories, but the ones about how we're working together to change the conditions in our community and why that's so powerful.
I appreciate so much what you're saying. We're actually starting to run out of time. So there's a couple of things I actually wanted to make sure that we touch on, and I want to do that. So those of you who can actually come to the discussion group, let's continue this conversation with Dr. T. But one of the things I want to ask you about is, who is the community stakeholder? How would you define a community stakeholder in desegregation efforts, and how do we unify them to take action?
Great question. Oh, awesome question. Oh, I could take a long time on this, but I won't. The short answer is it's everybody, right? Because I think what I've described is in the case making is that we have to be radically inclusive. A part of the reason why we got ourselves in this situation is because we've had a whole lot of exclusionary policies that push people away from the table and had only a few decision makers about what our communities look like, about what's built, about where things happen, about where resources go. When you open that up and invite everybody into that conversation, right, then it changes the nature of the conversation, right? So the short answer is everybody. And in my book, I try to talk about like what it means, right, to open that up and invite everybody, right, with no matter where they start, everybody starting at different points in the conversation. Some folks know a lot about the history of our country and how we got here. Some folks know very little. But our work, right, is to understand how to bring all of those folks forward by taking people exactly where they are, with no litmus test about what you have to know or what you have to believe. The only thing you got to do is come here and be helpful, right, toward the shared future that we're trying to get to.
I appreciate that. So beautifully said. And civic health is one of those things that's so important to our overall health and well-being. It's associated with community participation, such as volunteering. It's associated with political action, such as voting. How does segregation influence our civic health opportunities?
I love that. You just said it, Erica. You just said it. It's interesting when people are feeling demoralized and they feel like they don't have, their communities are in jeopardy and they don't see a future and they're challenged and they're nervous and they're anxious and they're afraid. The way to get people right out of that is by participation. When people start to participate in something constructive in their communities, it changes their whole demeanor about what's possible because they feel some agency, right? They take some ownership of what happens there. So what you see on the screen is the redress movement, which I've been involved in. For those of you who are interested in it, it's www.redressmovement.org, which is an organization specifically organized to address these issues of racial segregation, specifically in the housing space, for those who are interested. And then Just Action. My colleague Richard Rothstein and his daughter Leah have just written this book, Just Action, which is all kinds of ways. It's a sequel to The Color of Law, but the book has all kinds of ways that you and I can literally take just action.
Get involved in that participation. Yeah. So get your questions ready, folks. We're going to go to Joanne in just a second. But last thing I want to do is tell folks how they can learn more about your work and your services at the Case Made.
Absolutely. For those folks who are interested in having that data and understanding how to tell a thoughtful story that brings people forward, that builds public will to support, especially the stuff around equity that really requires a little bit of more of a strategic lens to get people to really lean into some of the work that we're trying to do, then we offer a whole lot of things on our website, obviously trainings and workshops, and we'll audit your materials and all kinds of things. The major thing I want to say to you all is, and I know this webinar today is a part of your journey, but to take the additional step to learn how to get strategic in how you do it. If you just put all that data out without, thoughtful ways of thinking about how you're going to organize that, it can backfire. And I talk about that in my book, Data Backfires. I'm so listen, this right here backfires. Here's a better way to do that. So for those of you who want more information about that, please look us up. We'd love to work with you.
Oh, Dr. T, you're awesome. I'm so glad that we'll be spending the next hour with you in just a little bit. Joanne, I know there's tons of questions, so I am going to mute and invite you to lead.
Wow, thank you. And Dr. T, you definitely changed the energy in this space. So thank you so much. And I want to also invite Christine back for this Q&A portion. I think we only have about 5 minutes, but want to try to get to as many as possible. So if Christine's there, we do have a couple of questions related more to her portion of the presentation. But I'll start with you, Dr. T, because someone asked, so we're talking about the data and sort of the impacts of policies around segregation. And Magdi asked a really insightful question, I thought, and that is, what would complete integration? What would be complete integration? What would that look like in our communities?
Yeah. So it's interesting. I want to just say, so I'm gonna give a short answer, and then we may take this up in the Q&A, because
Yes.
there's a long answer. And the reason I'm saying that is because there are lots of folks who don't necessarily want to live in completely integrated communities, which is interesting, right? The most important issue is that people have the choice to. So if you decide to live in a community that is incredibly diverse and inclusive and all, great. And if you decide not to do that, that's your choice too. The challenge now is you really don't, for lots of particularly people of color, you don't have the choice, right? You don't have the choice of where you want to live or what your environment looks like. And so it's about how you begin to do that. But I do want to say that when we think about what does it look like for us to get up and over racial segregation, what it looks like is we would no longer be able to predict your life outcomes, right, with race. And right now, today, the primary predictor of your outcomes in life are about your race. That should never be the case. A baby born, right, in any part of the country, you can look at that with race and maybe one or two other pieces of data, and you can basically write the script, right, of what the outcomes for that person will be. That should never be the case. We should never be able to use race as a predictor of your life. And so when that is changed, when race is no longer a predictor of who you are and what you can have and where you can live, we will have gotten up and over this issue of racial segregation.
Thank you. Thank you for refocusing us back to looking at the outcomes. So that really is what we really should be looking at. I'm going to come back to you, Dr. T, but Christine is back. And Christine, Sora asks, you shared some data from County Health Rankings about segregation patterns between Black and white in communities. And Sora wanted to know, to what degree do the Black-white segregation patterns also hold true for other racial ethnic groups, Hispanic, Asian Americans, and Pacific Islanders?
Thank you for that question. So those patterns will certainly vary by place and by the racial compositions there. What I can say is that on average, white residents tend to live in locations where there is less diversity, racial diversity of any kind. So it's more common for Black and Hispanic and Asian Americans to live together, and for white Americans to live separately. That's a pattern that we see to hold. But I do appreciate bringing to broadening this question. I think that sometimes it's easy to measure Black and white segregation, maybe because of sample sizes in the population, just from a measurement standpoint, and that's a limitation. But if we can go back to history again, I think we talk a lot about the Brown versus Board of Education and that US Supreme Court case that declared racial segregation in public schools as unconstitutional. But almost 10 years before that, there was a different federal case called Mendez versus Westminster School District. And that case ruled that segregation of Mexican American students is unconstitutional. So we know that this has been happening a long time in our country, and it's not something that just affects Black and white residents in the US.
Oh, thank you for that. I'm grateful for that question. So you could bring that to light. This question is for both of you. I think people are, were certainly inspired. You presented things in a way, both of you presented things in a way that make people want to move to action. And oftentimes, as you both touched on, community context is so important, or knowing how to apply strategies to counter segregation is so important. Can any of you highlight some communities that you know of? I don't know, Christine, if there's anything too in what works for health, but communities where cities, counties, towns have actually done some specific things to address segregation. And we can sort of look up the details later, but if any communities come to mind, that would be great examples.
I don't have a community to name, but I appreciate this question so much. I have heard stories of communities carefully redrawing school district boundaries so that they don't fall across residential segregation lines and aren't impacted and intertwined in that same way, just trying to break a little bit, if we can, the connection between residential segregation and school segregation, and maybe full school funding adequacy as well, because we know that schools are funded by the taxes in that location, right? So that's one example that I have heard of, and I would welcome so much in the discussion group to hear stories from all of the counties that you represent of success.
Absolutely. Thank you for reminding us that people in the audience might have some great examples. Dr. T, does anything come to mind with this question?
Well, I know we're short on time, so I'm going to say that in Richard Rothstein's Just Action book, it's literally an entire book of him giving examples of what's happening in terms of some communities in terms of racial segregation. I also point to the fact that there have been communities in the past that were built with the idea of inclusivity in mind. I lived in a community called Columbia, Maryland, that was built by Jim Rouse, who was a developer in the 60s, who decided, listen, this is ridiculous. I want to have a community where people of all races and income levels live together. And he built a community that was very intentional about its inclusivity, about issues of faith, right? So there are no churches, mosques, temples, etc. There are meeting houses all around the community. And on any given day of the week, all of those religious services are held in one, right? So in this room, you might have Muslims praying, you might have Jews in that room, and you might have Christians over there, you might have the Sikhs over there. I mean, it's just incredibly inclusive. He didn't want mailboxes on anybody's doorsteps because he wanted people to go to centralized mailboxes, because 5 o'clock, they all went to go get mail. And he wanted them to intermingle. There are swimming pools in every single community that are community swimming pools. This is the last example I'll give, because he wanted to make sure that every child in the community had a place to go to swim, because you remember in the 60s, and I think Heaven talks about this, folks were pulling swimming pools out because they didn't want to integrate them. He said, no, I'm not going to pull them out. I'm going to put more in. But the only caveat is that they have to be open to every single person who lives there. And so the built environment was created in a way to instill, like, integration. Even the size and scale of the homes, there were apartments and middle income and mega mansions and all of that mixed in, so that even if you now wanted to go back and segregate that community, it's really hard. It's really hard.
Sounds amazing. Thank you so much. Erica's moving us along, but everyone, I encourage you to come to the post-webinar discussion group to hear even more. And we want to hear from you too about great examples. Thank you so much.
Thank you. Oh, and that's so beautiful. It kind of leads me to this message. And while I'm reading this message, I'm going to go and ask Colleen to send out the link for our feedback survey, because we would love to hear from you about your thoughts about this webinar. But the fallout from segregation, folks, is too great to ignore. So know that healing from segregation is possible. We don't have to be stuck in a cycle of oppression that harms not only the oppressed, but the oppressors. We can dismantle and transform the systems that brought us to this point. That's why we do invite you to continue this conversation with us next month as we round out the series with author Richard Rothstein. So we've been talking about how he and his daughter just released this awesome book. It was released in June, and it's a follow-up to his book called The Color of Law. So Richard Rothstein will join us as we explore strategies to dismantle segregation And as Dr. T said, there's lots of examples in there about what you can do, as well as communities that have actually done the hard work of dismantling segregation. So please make sure you register for that webinar today. And lastly, Colleen is now chatting out the ways that you can join us to continue this discussion with Dr. T. We also want to hear from you about what you're doing in your communities. So please plan to come to this discussion group, and Joanne will be facilitating it. They're always so much fun. Definitely good ways to engage. Lastly, be sure to stay in touch with us throughout social media and by subscribing to our newsletter. It really is the best way for you to learn about our discussion groups, our podcast. I would say our webinars, our podcasts in solidarity. And I also want to thank Dr. T and Dr. Christine Muganda for sharing their wisdom with us. And thank you for all that you do to build equity in your community. So I look forward to seeing you in the discussion group and next month. Have a good afternoon.